And good morning. It is 23 minutes after 7 o'clock. And joining us in studio this morning from Lovelace Regional Hospital and the SCOR Orthopedics part of Lovelace there, Jessica Steele with us this morning. Good morning, ma'am. How you doing today?
Good morning. Great. Thank you.
So you're you do you help folks with everything from joint issues to sports related issues,
exactly.
or any bones, all that kind of
muscles,
that kind of
bones,
stuff.
joints, all that.
Good deal. So you that's a pretty broad, because you get everything from probably kids and their little league injuries to adults and their stuff to even older folks that 20 years on that 20 plus years of running on that knee and things like that. Next thing you know, you start getting wear and tear, and maybe time to get some assistance to replace some of the parts that are worn out there. That's kind of your department there.
Yes, sir. That's right.
Good deal. So I'm very curious. What got you kind of leaning towards that side of medicine? What drew you to have that interest?
So I've always been interested in musculoskeletal care, physical activity, and physical education. And after PA school, that I knew that's the route that I wanted to go, to help people with their aches and pains and joints and muscles and bones.
Gotcha. I always, knock on wood, although I'm getting in that window of age where I might be needing to see more, because it's just life happens. Knees start hurting, hips start hurting, that whole thing. Mm-hmm. I've been lucky and haven't had a whole lot of those issues, but I always hear that the real, the science and the procedures, you guys, if there's a surgery involved or something to repair something, that's the relatively easy, the easy part of the surgery. Where the real difference is made is what happens afterwards.
Sure.
That's usually, and anytime I hear someone that has a horror story about a knee replacement or any of those kind of, it's always because generally they didn't follow the aftercare instructions of the medical professional here. The infection happens or the pain's not subsiding, and because 9 times out of 10, anytime there's a joint-related injury, once the part's been repaired, mm-hmm. the follow-on is strengthening and rehabbing and getting that joint back to where it can do its job, as it should before. But it doesn't do that all overnight. And if you don't do that work, you're going to have a lot of problems. But am I right? Is that really half the battle with most of the things you do in your line of work?
Yes, it can be very intense to do the rehab afterwards. And if there's ever any problem, you can always come see me in the orthopedic clinic, and we get it worked out and we get people taken care of.
Good deal. But my best advice to folks is when your medical professional says you need to be doing these, or, hey, every day do these stretches or do these, these twists. And I know you're looking like, yeah, okay, whatever. But it is the difference between a quicker recovery and a more long, stressful one.
Yes,
it really
that's right.
does.
Listen to the experts. Yes.
Atypically, what do you see on a given day? Is it mostly, is it the gamut where you just see a lot of degenerative stuff, or is it kind of ebb and flow on what atypically you're seeing on a given day?
It does. We do see some degenerative stuff, some arthritis, aches and pains, like you said, and then a lot of acute things too, such as sprains, like ankle sprains,
Sure.
muscle strains, tennis elbow, fractures. We do fracture care there, so any sort of broken bones.
And I imagine, too, you're probably seeing a lot more of that now that where people are coming outside and doing things more, and, which
Yes.
is good. We want all that. But with that comes, the hike and trail, and
That's right.
They step on the rock and turn their ankle or whatever that happens.
Accidents happen in the summer. Absolutely. People are outside. They're very physically active, and accidents happen.
I guess one thing, because, obviously accidents, you can't control when you trip on a rock or do anything. But one thing I do know is, when you stretch and do a lot, if you're going to do anything physical, especially when we get older, and I know we get older and you're like, wait a minute, I'm just going to walk around the block. I don't need to do a bunch of, but really doing that kind of stuff probably save you some trips to see you if you kind of do those things before you partake in any kind of exercise.
Yeah. Some pre-exercise stretching is always a good idea. And then if you have an injury, if it's painful for you, best advice is a little bit of rest, a little bit of ice, elevation, the old adage of rest, ice, compression, elevation. And if that doesn't help, then you can come see us.
Gotcha. I am also curious, how much of what you do is in your field hereditary stuff? Where, I mean, because obviously sports injuries, that's, but when we talk about, like, say, degeneration of joints and things, how much does family history come into play there, or is it more about lifestyle?
There is a component, yeah.
Okay.
Yeah, you could, there's a component of family history of bad joints, bad knees, bad ankles.
I didn't know if, like, hey, if your dad and your uncle and everybody have bad knees, odds are pretty good. When you hit a certain age, you're probably going to have those issues as well, too.
Yeah, that's true. Odds are pretty good that you will. But lifestyle is a big factor as well.
Sure. Well, yeah, obviously someone that's more active in things, if they're not doing the proper, stretching and things like that, then odds are they're probably going to have some issues. And conversely, for someone that's sedentary all the time, whenever you do some kind of physical activity, you're kind of overtaxing the areas because they're not used to doing that stuff.
That's right.
So if you do decide that you need to do some physical, it's all in moderation and to avoid seeing Jessica here before you need to. Do your stretching and things like that.
Yeah,
that way you don't have to say.
Do your stretching.
It might actually be. How much of the, for your day-to-day stuff, is most of it the aftercare stuff, or is it a lot of, because I imagine, once people have their surgery things, there's a lot of follow-on. Depending on the level of it, there may be some rehab they have to do and things. Do they do that personally through you, or is that through one of the physical therapy people?
So post-surgical care, they do see me for follow-up. And then if someone needs physical therapy, they'll go to a physical therapy specialist.
So it just depends on the aftercare, whether it's all through you or whether through someone who does that stuff all day.
Yes,
kind
sir.
Of thing. Very good. And obviously, so if it's something, probably less invasive or less, cutting open type things, it's probably stuff you can handle right there. But when you get to the point where you're going to surgery for repairing a joint or something, then you're going to go more than likely see the physical therapy folks, because that requires a lot of one-on-one and things like that to get that joint or whatever back to where it needs to be.
Yes, sir.
But I will tell you this. I know firsthand through my family and things, if you do follow the care and things like that, it does. And lifestyle comes into play. And I want to give an example with my grandmother. Now, this is a few years ago but my grandmother was, she was in her 70s, very healthy lady, but she drank milk. And I'm not trying to be, drink your milk, kids, but this lady drank milk every day, well into, as a lot of adults aren't drinking a glass. You know what I mean? It's not something common.
Right.
She did that. Well, in her mid-70s, she fell down the stairs and broke her hip.
Oh, I'm sorry.
And unfortunately, and this was back in the, late 80s, early 90s. So, and so back then there was even less. So it was not uncommon for breaking of a hip to literally be a death sentence for an elderly person.
Unfortunately.
And she made a full recovery in a very quick, she healed like a 25-year-old would heal as opposed to a 75-year-old would heal. And I don't, sure, I'm going to throw a little God and a little prayer in there, but the woman drank milk like it was going out of style. And I got to say that had to play
she
a
had
factor.
All her vitamin D, calcium. That's good.
I got to say that had to be a helpful part
Yeah.
in that recovery and things. So,
Good.
But please do not take that aftercare for granted. If the doctor tells you to run around, pat your head, rub your tummy, that's because they believe it's going to help you. Grab your head, pat your tummy, because it's, and I'm joking about that, but what I mean is, even though it sounds a little like, how could that even possibly? Because I've seen, like, if I've had a neck or like a shoulder strain, I'll see my family practice doctor, and it's not bad enough to see you, but it's something like, okay, is this something serious where I need to? And they're like, no, but here, do these stretches and do this, and after about a week, you're gonna see it go away. And I know you kind of look at it like, really? I went to you to tell me to do this,
Yeah.
And then, but you do it, and you're like, okay, it actually, and I noticed, like, the days I kind of blew it off, I'm like, all right, it's still, but then I did it, and it was, so please try, even if it sounds like, okay, how could that possibly help me wiggling my finger or whatever it is?
Yes. Or another big one is stopping smoking.
Yeah.
So that has a huge factor on how your bones and muscles and joints heal.
And I imagine most people don't think, I mean, because you think smoking, you think of all your lung and all those related, but in case you haven't noticed, your breathing is a very important delivery system to everything else in your body. You know, you're breathing that oxygen, it gets in your, gets into your lungs, which takes it to your blood, which takes it to the rest of your body. So whatever you're putting in through that portal is sending it through everywhere else. And so I didn't really think about it, but I'm guessing that cigarette smoking really impacts the joint repair and that kind of stuff while you're rehabbing too, huh?
Absolutely.
Didn't think much about that. They don't really say that in the smoking videos. Usually it's, heart disease or insert any one of the many, many things that it can do to you. But most people don't say it slows down your rehab of bone and joint issues as well. Well, I didn't realize it had that much impact on everything too. So another tip there, quitting smoking if you're having, these knee issues and all that, that might be one of the contributing factors to some of that stuff.
Yes, sir.
How much does that, is there other in every, like, how much does food come into play on some of that joint? Is that a big factor too at some point, or can be?
Well, it's important to have good nutrition, absolutely,
Sure.
Especially if you're looking at stress fractures or other fractures. It's a good idea to have calcium and vitamin D and good nutrition all the way around. As far as supplements, I don't think the research quite supports too much of that yet.
Gotcha.
But if it doesn't hurt, I'm a big proponent. I tell my patients,
sure,
if it feels better, you can go ahead and take it.
Gotcha. Well, and whenever you get in the vitamin and supplement world, it's you have to be careful because sure, there's some benefits there, but a lot of it's marketing, a lot of it's wasteful needs. And to be honest, if you just, at the end of the day, really pay attention to your food intake and what you do, you could probably get most of those nutrients through your diet. Obviously, if you're like, well, I hate X, and that's a good source of vitamin D or C or whatever, then maybe you should find another way to get that. But for the most part, eating the right foods and things will probably give you enough nutrients for your body to do what it needs to do. And the other stuff might be like, you always hear jokes like, well, yeah, you're eating all them vitamins, it's just making your pee expensive.
Oh, that's funny. Yeah.
And in some cases that is, some does not. But at the end of the day, if you really want to try something like that, Jessica, your healthcare professional, those are the ones you need to talk to, especially the people that are prescribing you whatever prescription meds you're taking.
Absolutely.
Because anytime you decide you want to take something over the counter like that, you need to talk to the doctor because it may counteract or create a bigger medical issue with what you're currently taking. Like, especially if you're dealing with diabetes or high blood pressure or those multiple cholesterol. A lot of times some people are taking all those pills and they decide a vitamin or something and that kind of counteracts what they're doing for those things. So that's why you need to talk to your doctors and healthcare professionals about that kind of stuff.
Yes, ask your healthcare provider.
I mean, obviously, some stuff you're kind of like, all right, yeah, it's probably safe. But a quick phone call, say, look, I want to take this. Is that a good idea, or is there another way I can do it? And like you said, if you're going to say, yeah, actually, that's probably pretty good. Yeah, I'd recommend that. Or you know what? Because you're taking this, I would stay away from that. But in its place, I'd do this, and that's where you can help them. But I know we're talking bones and joints, but that really does impact all of that too.
Oh, absolutely.
If you don't.
Yeah.
Do you deal with a lot of the sports like injuries and stuff like that? Is that pretty common?
Yeah, we sure do. Absolutely. Strains, sprains. A lot of that happens more often in the summer when people are outside. They're gardening and they're down on their knees, or they're working, or they're, like you said, Little League or something like that. We absolutely deal with a lot of that.
I'm kind of curious with the degenerative stuff. Is it how much of it, because it's some of it's just life. You know what I mean? It's going to happen. We can't avoid it regardless. Sure, we'd love to slow it down, but when it comes to seeing you for that, is it a lot of technique and a lot of things to do to kind of slow down that process, or is there things you can actually do to kind of stop or reverse some of that, or that's the battle we're going to lose at one point no matter what, because everybody gets older and that's just what happens. How much of that is stuff you can either slow down greatly or even prevent?
So physical activity is always good. I know with degenerative joint disease, physical activity can sometimes hurt because people can have, bone-on-bone arthritis. But physical activity is always a good idea. It's important to do low-impact physical activity. And then at the orthopedic clinic, there are several different treatment options, be it medical, be it equipment that you could use, or surgery.
But it's really, the exercising, it strengthens and keeps it from degenerating. So it's kind of like, think of it like a car. Like if you just leave the car sitting in your driveway for a long time and don't mess with it, at some point it's not going to start.
That's
or nothing,
right. That's right.
Same thing with them joints and stuff. If they're sedentary and then when you decide you want to use them, they're like, hey, I don't, and they start barking at you.
That's right. Yeah.
And so it's kind of like that. It's if you don't use it, you lose it kind of mentality on some of this stuff. So really, the best way to combat that is to take your walks, do your things to keep those muscles and joints strengthened. So as you get older, there's more there to keep you going and stuff, rather than you not utilizing it, depleting it, and then making it so weak that when it is to that point, it's really hard to regenerate it without replacing the entire joint or getting to the point where they're cutting you open and doing a major surgery on you. So,
right. Yeah, you're exactly right.
good deal. So, generally speaking, when people are dealing with the degenerative stuff, knee, hip, joint, is there a optimal time to kind of, like if someone in their 40s, is it too early to be thinking about that? Or is that really the sweet spot? Like, when's that time you really should be kind of saying, this is that time in my life I really need to be more cognizant of some of these issues?
So as far as optimal time goes, I can't think of, an optimal time where you need to say, okay, it's time to go in.
Okay.
It's all determined by your pain level, your personal pain level, because people can go and go and go until they're 70, 80 years old without pain sometimes. And then sometimes people just have painful knees at 40, and maybe that's where hereditary factors play in, or lifestyle, or, the type of work you do.
And I was, also thinking too, even if you are a athletic type, if you're not doing your aftercares and things properly, it probably speeds up that process. It's kind of like NFL football players. You look at running backs, and the average running back has got 5 years in it because they get beat up so bad.
Yeah.
But like their knees and things. So, but obviously these are peak physical shape people. They're working out constantly and everything else. But if you're taking that much punishment, then odds are you're probably going to have more pain in your 40 than the person that wasn't getting tackled by 10 people.
That's right. Yeah.
Every play for 10, So it's kind of that sweet spot. It's like, yeah, you want to use it and act, but if you're overusing and abusing it for years, you're going to have just as much problem as the person who didn't do anything.
Yeah, a lot of people have an injury and then they like to ignore it and wait for it to go away rather than seek medical care. And it's important to come in and just have somebody take a look.
Sure. You talk like professionals, especially like football, and you hear about the athletes 10 years later and you see them and things. Granted, they talk a lot in the concussion world and all that, but how many of those guys, they can't move because their back's stowed up or their knee it no longer bends as full, or you look at their hand. Have you ever seen like a lineman's hand? And they usually have fingers that are pointed in 6 different directions and everything else. And it's a lot of what you're talking about here. They've been doing this day in and day out and not getting the time for it to heal and care because they're getting paid millions of dollars. And what do you mean you're out because of a broken finger? Put a piece of tape on that and get it back in there. You know what I mean?
Right.
And that mindset. Now, most of us aren't dealing with that because we're not NFL players, but it's kind of an example of, take care of yourself,
Right.
Even if you are that physically, if you're not doing your stretching and if you're not doing your cool downs, if you're not dealing with the aches and pains in a proper way as you come, when you hit your 40s and those later years in life, you're going to be wishing you did that kind of thing because you're going to be the one with the degenerative knee and joint issues because you work hard, you play hard, you're going to need to recoup hard too.
That's right. And we may not have a lot of major athletes out here, but we have a lot of hard workers that do get back into work before they should, maybe. And so,
well, it's the human mindset. We don't like to be limited. We don't like to be told we can't do something.
That's right.
So you're going to, at the detriment of your own personal health and safety, go to do that to prove that you can do that. And I get it. We're all boneheaded. We all have a little thing in us that does it. I don't care who you are, where you come from. When someone tells you can't do it, we all have that little bit of, oh, yeah, watch me.
That's right.
And which is great for humanity, but sometimes bad for your knees. So, and I would even say for you younger high school and those that are playing high school sports right now, be cognizant of that. I know you're young and work hard, but you got a lot of years left on those knees and things like that. And I would hate for you to ruin that for you when you're 16, 17, 18. And because trust me, when you're 35, you're going to be regretting that decision.
Yes, don't ignore it because it will catch up with you.
So please, when your coaches and everybody telling you to do your cool downs and your stretches, take all of that stuff seriously. Trust me, your 35-year-old self will thank you very much if you do it.
That's right. That's right.
Of course, for your stuff, they can come and see you direct. I know a lot of times people go to their primary care physician, especially if they got a knee joint or, hey, my knee's killing me, doc, and then they may come, say, well, you need to go see Jessica over at SCOR, and then she can go. But you don't have to do that. If you've got knee pain or whatever, you can cut out the middle person, so to speak, and cut out your primary care and call the SCOR office direct and say, look, I got some knee pain or joint pain. I would like to set up an appointment to see what we can do about it, and they'll be happy to do that.
That's right. And most days you can get a same-day appointment.
Good deal. So you can get it in quick, and so if you call, say, like this morning, and say, yeah, my back's been killing me. I need to get it looked at. And Jessica and her staff say, well, come on in at 1 o'clock today. We'll get you looked at and start you on the road there. And then obviously if it's something serious, then the trail to get that done goes. But if it's something as simple as, you tweaked a little bit, some rest, some stretching, some ibuprofen or whatever, we'll take care of that thing there, and that's another thing I do want to talk to you a little bit about, because we do live in this world of pain meds and all of that stuff. How much in your line of work have they altered philosophies on that? Because I imagine in your world, sure, the pain meds and things, the knee pain, and that's very much part of it. Has the philosophy changed a little bit and stuff, like because doctors and medical personnel constantly, that's changing. Did the philosophy, and they say, hey, you need to, let's steer away from here, instead go here. Has that been kind of the lay of the land in your world, or is it a case-by-case basis type thing still?
Well, yes, the overall philosophy has changed over the last few years. As you know, there's a major opioid epidemic, and so...
but there is, don't get me wrong, certain surgeries, certain things, if you need the Percocet or whatever the latest one is, please do. It's with moderation and everything else, and please be. But like we said here, but we also gotten to a point where doctors were saying, because at the end of the day, it's all about customer service and everything else.
Absolutely.
Patients come in, my knee hurts, and they just, okay, here's your Percocet, and then they're like, thank you, and then they go away. And we're learning, there's a big problem by doing that. So, that's kind of where we're at now. So I was just curious if they kind of, in the big world, it's like, okay, instead of normally saying, let's do this, let's feed them into the more of the rehab type stuff, stretching and working those things moderately to build them up, not to mask a pain that could be telling you something more important.
Right, and we're looking at better medicines to treat pain, inflammation, like you said, rather than just masking it. We want to make sure we take care of it and get it treated appropriately.
So it's better science, it's better medicine, and that's a good thing. And we all need to remember that life is like we learn. We get, being a doctor in 1960 is not the same thing as being a doctor in 2022. It just isn't. It's night and day different. I'd even wonder if a doctor from 1960 come in and be like, what do we even, there might be things that are just a foreign language to that person at this point, because so much has changed in that time period. So,
that's right.
But that's true in everything in life. It doesn't matter. If anything, take whatever you're fooling with now, your cell phone, your car, whatever it is in your hand right now. There was about 20 versions of that thing that stunk before you got to that one.
That's right.
And that's just, but it's no true in medicine, everything else. It's trial and error. And so So how they did a knee replacement in 1980 is not how they do a knee replacement in 2022. It's, so even like the stories you hear, if you're talking to someone that had a knee replacement like 5-10 years ago, it's a little different than it is today. As science and technology, and I don't know if it's the whole nanotechnology or all that world, but they're less invasive for surgeries. They can do things with needles and cameras instead of knives and scalpels and saws and things now. It's a whole
right. There's been a lot of advancement.
And with all of that comes better, aftercare, better results, better everything. So,
exactly.
So please don't ignore these things. Get them done. And I'm guessing your line of work is probably some of the most painful for your patients, but also in terms of stubborn and getting looked at, the most highest end of that too, because especially when you get older folks and they got knee pain and they don't want to look at it because of the other things. Well, I got to take care of this person. I got the grandkids. And by the time all that happens, they're so stowed up they can't move anymore. And so don't be that martyr. Don't be the person that takes care of everybody else and don't have your own medical needs looked at, especially if it's something mobility related or dealing with your physicality of moving and things like that. You want to keep helping your family and friends, you're going to need that to do that. So if you don't take care of yourself. So please don't ignore those nagging knee pains and things like that. If you notice that your knees hurt every time you go up and down the steps and it doesn't feel just normal, maybe it's time to get that looked at. And at the very least, Jessica could be like, you know what? It's just part of getting older. Just do a little stretching and maybe, mindful of it. It's just part of life. Or maybe it's, you know what? We've got some ligament damage here. Maybe we can do some repairs and things, and you're back to normal.
Yes. Yes, you're right.
Either way, don't ignore those things. Get them looked at, and don't even automatically chalk it up as you're getting old too. Because I know a lot of us and I do, I'm guilty of it too, You get up and your back like, ooh, that sucks being old, and you move on about your day. If you're regularly seeing that kind of stuff, maybe it's not an old thing. Maybe you tweaked it, or maybe you didn't. Yeah. Something just happened there.
Well, and there's options. When you come to the clinic, we have all different options to help you get back to living your life, doing the things you want to do, get back to sports, get back to your morning walks, whatever it may be that you want to do,
And here's the thing: we don't realize how out of sorts we get when we don't do those little things in our part. Like if part of your day is to take that walk after breakfast or whatever it is, when you can't do that anymore, you don't realize how much it messes up your life and even changes your mindset a little bit, where you're a little bit crankier, just a little bit like, oh great, now what? Because you didn't get your walk, you didn't get your routine. So don't ignore those things. Make your life happy. And like I said earlier, you don't have to. You can. Get an appointment direct. You don't have to go through a primary care or get a referral. Just call the SCOR office direct, 575-625-3300. Again, that's 575-625-3300. Call, schedule appointment, and like Jessica was saying earlier, you might be able to get in today. Like you call right now, or I think, what's the office open at
8 a.m.
So here in about 5-10 minutes, give them a call, and then they can probably maybe get you in later today, depending on what they've got going on here. But if you're dealing with sports industry, sprains, things like that, do you guys do any of the sports physicals and things, or is that more primary care physician stuff?
That's more primary care.
Okay, so, but if you get your sports physical and they find something not quite right there, then you can go get an appointment with Jessica here and get that fixed.
Absolutely.
So, good deal. Again, that phone number is 575-625-3300. So is there anything we missed? Is there anything? Did we get it all?
You covered a lot. Yeah.
Good deal. And then some. Well, very good. Well, you're actually one of the few people that I hope if someone needs it, they come see you. But at the end of the point, I hope they don't need to see you very often.
I know. I hear it a lot. Yeah.
Very good. Well, I'm sure you got a few people waiting for them to have you take a look at them. So we'll let you get back to the office.
Thank you so much.
Thank you very much. Have a great weekend, and welcome to Roswell. Like I said, she's only been here since about the beginning of the year here.
That's right. Yeah.
So where did you come from originally?
Georgia.
Oh wow, this is a
I
big
moved from
culture
North
change.
Georgia.
Okay. I'm from Maryland initially, so I know about East Coast.
You're out on the East. Yeah, okay.
Well, it is truly a dry heat, and it is a difference. I know how Georgia stinks, too, when it gets July in Georgia. You don't want to be anywhere near it either.
Oh, yeah.
But it is a little bit better. You get used to it. I've been here since 2000. Well, 96 actually with military. But so I've lost my ability to get humidity.
Yeah.
But still, I'm like, yeah, don't get me wrong. Their line's like, oh, it's 110. Shut up, it's hot. I don't care what it is.
I know.
But yeah, you do appreciate the fact that you can go outside at night or find a tree and be shady and be cooler. So
yes, sir.
that doesn't happen in Georgia. It just doesn't work that way. So, but thank you, appreciate it, Jessica. It is